Workers at Pelonomi Hospital's maternity ward have downed tools. Nurses are complaining about an acute staff shortage. It's the second time in 3 weeks that nurses have embarked on a strike.
Overworked nurses painted a dire situation at the Free State's biggest hospital. They treat about 700 patients a month and as a result, often work long and irregular hours.
We want the management to hire staff, new staff, because we are suffering. The patients are also suffering. We are also exhausted. We work with so many patients and it's very tiring for us.
They said they have made a submission on the 4th of June. Until today, we are still waiting for the submission. And the exhaustion, it doesn't wait for the submission. It needs staff now as we speak. And we don't even talk about the time frame. We talk now. We want staff now, not tomorrow, not on Thursday, not when, now. We will go and work. Immediately when we have the staff, we'll go and work.
We are concerned about our community and our patients because we are experiencing so many maternal deaths. So really, HOD, we are pleading with you. Please hire staff. Hire more staff, please, HOD.
The Free State Health Department says nurses have jumped the gun as the recruitment process is underway and 13 nurses are to be employed immediately. Nurses say they did everything in their power to resolve an impasse, but their demands have gone unheeded. The department says nurses' concerns will be resolved by Thursday. Action will be taken against those who took part in the unprotected strike. Teboho Letshaba, SABC News, Bloemfontein.
Well, for more on that story at the Pelonomi Hospital situation, we cross to our reporter now. That's Aphumelela Mdladlana in the Free State Province. Aphumelela, patients clearly bearing the brunt of a second nurses' strike in just 3 weeks.
Indeed, Crosby, like you just mentioned, it was the second day actually of the strike taking on at the Pelonomi premises. We must remember that this is one of the biggest, or rather let me just correct myself and say this is the biggest public hospital within the province that take more patients now and then from across the province. But with me right now, I'm joined by the MEC for Department of Health, Methiwu. She will be just telling us more on what resolutions they've come up with. You had a long meeting. What resolutions did you come up with?
We agreed that today by 1 o'clock we will interview nurses that would employ those that we are going to employ for permanently, and there are about 13 that we will give a fixed contract, short contracts, as we are embarking on the process of employing those that we are going to employ permanently.
MEC, there's also, we managed to see also that someone passed away over the weekend, and when we talked to the workers, they were saying that is because of understaffed. Can you say something about that?
Well, indeed, they were understaffed. Unfortunately, they were understaffed at the very busy weekend. We had only 2 professional nurses in the postnatal unit of maternity. And the unfortunate part, when we tried to find out what was the cause of death of the lady, was the embolus, of which we cannot pin it specifically on the issue of shortage of staff, because everything that was supposed to have been done to the lady was done. But after having delivered and after going to a theatre for evacuation because she had retained placenta, after everything that was done from theatre, she passed on, and the doctors are suspecting that she had an embolus, which is something that most of the time is unavoidable and cannot be seen.
Who was assisting today, because the nurses from the maternity wards went on strike for some hours? Who was assisting there, because we know that's a critical part of department?
We took all our area managers to go and assist in maternity this morning, and the doctors were also doing their jobs today.
We also saw that the workers from the kitchen, they are striking over salary wages. Did you come up with a resolution from that? Because they say that is not a living wage.
The kitchen staff of Pelonomi are not employed by the department directly. It's an outsourced service. The service provider is the one they were negotiating with on the issue of salaries. So we hope the salary negotiations will go well, because we are paying the salary, the service provider to pay the workers. We just hope they have solved the matters, because the workers have gone back to work. We think then the solution was indeed reached.
Surprisingly, MEC, also some cleaners came to us and talked to us and told us that there's a problem with equipment there when it comes to cleaning, and they also have to assist. They also crying about being understaffed. Did you also touch on the issue of the cleaners within the hospital?
In our meeting with the trade unions, we agreed that the matter at hand is the issue of maternity, which is the important matter right now. There's a whole range of demands that the union had. We agreed that we're going to have follow-up meetings to follow up on other issues. As long as we can solve this matter of maternity, that workers must go back to work, and then other things would then follow.
We also know that there's an issue of overcrowding within the hospital, patients coming in numbers. How are you resolving that? Are you accepting patients? How are you trying to make sure that all patients are being attended to?
We have a referral system in the Free State that states exactly where the patients must get help. But unfortunately, Pelonomi, as the biggest hospital, is right at the center of the township. You cannot deny patients walking in, even those that self-refer. And all the hospitals in Free State, including Lesotho and the Northern Cape, are referring to us as Pelonomi. But we are accepting all the patients. And indeed, that is why we agree with the nurses that they are short-staffed. At the moment, the people that we have employed at Pelonomi at the moment, they are 50. We have got 57 professional nurses, and if we have to say we are at an ideal situation, at least we could have 70 professional nurses, and we only have 6 staff nurses and 29 enrolled nursing assistants. That's a huge understaff, and we agree, because remember, the maternity is divided into 3 sections. That would be the gynae, where we have pregnant mothers, then it will be labor ward, and then it would be the postnatal. And they're also taking care of the cesarean sections of all other hospitals that do not perform cesarean sections.
We've also had rumors, MEC, that National is on strike. How true is that?
With the National, the strike that was at National was not directed as the department. It was the issue of the kitchen staff. The kitchen staff of Pelonomi, National and Visitors, they belong to the same company, and it was the strike of the wages of the company, and it has also been resolved. The workers are back at work, and the patients have been fed.
Okay. Would you like to add something more in terms of these timeframes? I hear that you say 90 more will be employed, but timeframes, when in particular?
We have agreed that from today, tonight, there are nurses that would come from the agency nurses to come and augment on the present staff for tonight, as we are still busy with the interviews. Remember, we have to interview these nurses, because we don't want to say we have employed nurses. Unfortunately, we have employed nurses that do not have the requisite skill that you need in maternity. We are trying to get the best of the best, because we don't want mothers dying there. So we are going to use the nurses from the agency for tonight and until maybe Friday. But from tomorrow, we are bringing in our own people that we would have employed, and we have those time frames. We agreed that at least let's make, the unions had proposed that we make a fixed term contract of 2 weeks, but we agreed that we'll make at least a 1-month contract, as we are busy with the processes of employing those ones that we are going to employ permanently. And we are saying, if we have everything else has failed, but the 13 professional nurses that we are employing this week, all of them are going to be allocated to maternity.
MEC, we've also seen that just in 30 seconds, we've seen that in their placards, they're also talking about the HR that has to be removed because he or she hasn't been attending their issues. Do you know anything about that?
You know, I can't say those people have not been performing their duties. They have. The problem that the department is taking too long to process employment is the issue of the fact that the Free State Department of Health has been under administration since 2013 of the provincial treasury. So that issue in itself is taking time, because you need to first make submissions, they take too long to come back for us to process employments. And the other issue is that as the department now, we are going to all our facilities in the province, doing unannounced visits to check if things are still going well. We are checking from issues of staff, from issues of equipment, and we agree that we are challenged, but it's not just us. The national department is challenged in as far as health professionals are concerned, but we are addressing that. And I think as Free State, we are on top of issues.
All right, we've heard it all from the MEC for Department of Health in the province. She just mentioned that everything now is back to normal as they had a long meeting with the union's representatives from the workers. All I can say is that we've heard that things are back to normal, and for now, I can say it's back to you in studio.
Well, our reporter Phumelela Mdladlana coming to us from the Free State's largest public hospital, Pelonomi, where nurses have gone on strike, we understand, due to some staff shortages there. The MEC for Health saying this afternoon that recruitment processes have indeed commenced for new intake of nurses at the hospital.